So it begs the question, is it possible that COVID-19 immunity could last for years?
To give us his perspective, we are joined by Dr. Anthony Cardillo, CEO of Mend Urgent Care and ER physician. Dr. Cardillo, well, since those researchers found that SARS patients still have crucial T cells from infections from 2003, does that suggest the same might be true for COVID-19 patients, and why would that be significant?
Yeah, this is very significant. This is a great research article that came out of Nature. And we know that the immune system is quite complex, and we have T cells and B cells, a lot of cells making an attack against invaders. Now, the T cell is the T helper cell. It's part of our adaptive immune system. Those T cells present the data to the B cells, who then make the antibodies. What we found with the SARS-CoV-1 virus from 17 years ago is that people that were infected that long ago still have adaptive T cells to this day, meaning that if they get reinfected, those T cells are ready and prepared to present data more rapidly to the B cells that then turn on the antibodies. So it's not just the antibodies that the B cells are making that we know are coming down a little bit after this infection goes on for a month or two. It's the adaptability of those T cells. And we are finding with SARS-CoV-1, those cells are still present, and they're still able to activate the B cells very rapidly. This is exciting news, meaning that if you have T cell exposure, you may have immunity to this. So we're going to follow this very carefully, very exciting. And we know that it's part of the complexity of the immune system. It's not just one piece of data, but all of it in conjunction.
Yeah, that'd be great. Okay, so doctor, there's a common thought that people wear their masks to protect others, not themselves. But now some infectious disease experts are saying that even if a mask wearer gets infected, wearing that mask prevents more severe disease. Can you explain that one?
Yeah, certainly. Unfortunately, the narrative has been out there that just wearing a facial mask and facial covering is to protect others, not necessarily yourself. Now, that should be enough for all of Americans to take that seriously. But unfortunately, some people aren't as concerned about others as they are about themselves. So this data has been surfacing now, showing that it's actually the viral load that you get exposed to, how much virus actually gets into your system that you're exposed to, that has a correlation with how sick you get. And some people are having very mild illness because they had very, very casual exposure. So if you're all wearing a mask and a facial shield, the thought process is, and the theory is, that you're not going to have as much exposure and as much viral load. Therefore, you won't get as sick. I think it's a phenomenal piece of information, phenomenal data to show now that the masks are not just helping others, but helping yourself.
That is great information. Well, our Ask the Doc question is from Elizabeth in Stanton. She says, I'm a school bus driver and my bus capacity for passengers is 81. I am a proud 60-year-old female. How can I protect myself and my students?
Well, first of all, thank you for your service. This type of essential worker is critical in helping to get our students safely to and from school. I will say at 60 years old, you're at a little bit of a higher risk. 81 students is a lot. The first thing I would do is work with your leadership to maybe cut down the number of students on those buses so you have more social distancing. The next thing is obviously face mask and certainly a face shield to cover down in front. And then it may be wise to work with your bus manufacturer to have a plastic shield that's just covering the side of you. So as the students are coming on, you are at least protected for any direct coughing and sneezing. Once you're in the front of the bus and you're driving, you should be fairly safe. Windows cracked open, you'll be okay. But again, social distancing on the bus, full mask, full face shield, gloves, and plastic barriers, and you'll be okay.
Yeah, otherwise it's a very dangerous environment. All right, Dr. Cardillo, again, thank you so much for all you do. And Dr. Cardillo is answering your questions about coronavirus every day here in Eyewitness News at 4 o'clock. And to submit a question, go to abc7.com/coronavirus and click on Ask the Doctor.
Hello, I'm Mark Brown. Click the ABC7 logo to subscribe to our Eyewitness News YouTube channel.